Welcome to OakLeaf Surgical Hospital. We look forward to meeting you for your upcoming surgery. In this video, you will find useful information for you and those helping to take care of you when you are home. Some items we will cover in great detail, and others you will be just introduced to, as they will be covered in more detail during your stay. If you find you have questions about home safety, equipment needs, or the ability to manage the post-operative routine, we suggest that you speak to your physician about a pre-operative physical therapy visit. At that visit, a physical therapist can educate and assist you in getting your discharge planning for home all taken care of, including a walker, crutches, bathroom equipment, and to teach you your exercises. During a large vehicle transfer, the patient approaches the vehicle using a front-wheeled walker. She is taking small steps while turning to avoid pain. She uses the step and the door to help position herself safely. The patient's helper gives her support at the step and the walker as needed. Note that the patient uses the non-surgical leg to lift herself into the vehicle, avoiding pain and range of motion restrictions. After sitting, scoot as far back into the reclined seat as possible to allow room to place the surgical leg inside. When exiting a large vehicle, with or without running boards, it may be helpful to have a 6 to 8 inch step to accommodate safety. When moving from the sitting position, use small steps. Exit the vehicle using the door handle, overhead handle, center console, or helper. A helper can stabilize the step and the walker. Step down, leading with your surgical leg. To maintain proper joint position, use pillows to raise the height of the seat. Patient approaches the vehicle, protecting her surgical leg. Small steps ensure safety as she backs into the vehicle. Patient can use the door, a helper, or the console to help lower herself into the vehicle. Small movements as she scoots back into the seat allow clearance of the surgical leg into the vehicle. Patient uses small scooting movements to adjust her position in the car. She slides gently towards the edge of the seat, using the door frame, a helper, the console of the car, and the door to assist her. A helper can stabilize the walker. The patient uses this standard toilet with the help of a toilet seat riser placed inside the toilet bowl. Surgical leg is placed out in front to protect against range of motion restrictions and avoid pain. When moving into a standing position, push straight up using the walker for assistance. Patient uses this standard toilet with the help of a commode with handles, allowing herself to sit safely. When moving into a sitting position, please note the tall, upright posture. Move the surgical leg out in front to protect and avoid pain. Prior to standing, place the surgical leg out in front. Notice the patient taking small steps to avoid twisting her joint. When moving from a lying down to sitting position, move towards your strong side. Scoot your hips with the help of the edge of the bed and your strong leg. From sitting, push up into a standing posture from the surface of the bed. A helper can assist with bed mobility by lifting and moving the surgical leg. Support at the arms and trunk can help with sitting. When moving into a sideline position, a folded pillow can help maintain hip position and comfort. 2 pillows placed in this chair will make the chair the proper height for range of motion restrictions and joint comfort. Surgical leg is placed out in front to avoid pain. Handles are used to slowly lower onto the chair surface. When moving into a standing position, place the surgical leg out in front and use the handles to stand up tall. When going upstairs using a rail and a crutch, go up with your non-surgical strong leg. Step up with your surgical leg. When going downstairs, the crutch and the surgical leg go together. Non-surgical leg steps down to meet. When using 2 crutches going upstairs, step up with your non-surgical strong leg. Follow that with your surgical leg and then the 2 crutches together. When going down, the crutches go down first, followed by the surgical leg and then the non-surgical leg. When walking, move the walker forward. Step your surgical leg into the walker. Then, using your hands to assist with weight bearing, move your non-surgical leg forward to meet. When using crutches, move the crutches forward. Step your surgical leg directly in between them. Then step forward with your non-surgical leg. These items are some of the assistive equipment devices that you may find beneficial after surgery. They can be borrowed, rented, or purchased. Further discussion on your individual needs will occur during your physical therapy sessions. A reacher is used to grab items from the floor without compromising range of motion restrictions. Ankle pumps. Gently pump your ankles up and down. Quadricep sets. Tighten the muscles on the top of your thigh, pushing your knee down into a straight position. Heel slide. Pull your knee into a bending position by sliding your heel towards your buttocks. Keep the kneecap pointed towards the ceiling. Gluteal sets. Tighten both buttock muscles, then release. Hip abduction and adduction. While laying down, slide your surgical leg out to the side and then back to the middle. Do not go beyond range of motion restrictions. Short arc quads. Place an item the size of a coffee can under your bent knee. Straighten the knee by doing a short kicking motion, tightening the muscles on the top of your thigh. Long arc quad. While sitting, straighten the knee on the surgical leg as far as tolerated. Then bend the knee as far as possible. Hopefully the information you've gained here today has been helpful to you and your family members as you prepare for your upcoming surgery. If you have any questions regarding any of the information, please reach out to one of your providers. On behalf of OakLeaf Surgical Hospital, we wish you the best for a speedy recovery.